medical student, come closer. 3 minutes of tetracyclines. Tetracyclines, they end with a suffix cycline, and examples include demeclocycline, doxycycline, minocycline, tetracycline, and others. Of course, they are amphoteric, meaning they are neither acidic nor basic. They are there in the middle. But the most important thing is that they chelate with the metal cations. So therefore, we are not going to take these drugs, divalent cations like magnesium. So avoid dairy products, avoid taking them with drugs like antacids. Of course, the mechanism of action, just like the aminoglycosides, they inhibit protein synthesis at 30S ribosomal subunit. They are broad spectrum in that they are active against both gram-positive and the gram-negative microorganisms. Whatever you're seeing here is whatever you're seeing in green is a 50S subunit, and whatever you're seeing in 30 is a 30S subunit. And the tetracyclines, like the aminoglycosides, they work on the 30S ribosomal subunit. Of course, they have gained resistance, and it is through impaired influx. Some have ribosomal protection due to production of enzymes that interfere with that, and enzymatic inactivation that inactivate the drugs. In the PK, I've told you that their absorption is affected by the divalent and the trivalent cations, except for doxycycline and minocyclines. They are widely used in treatment of very many conditions, and they are highly excreted in milk, meaning they can cross the placenta and at the same time they can affect the breastfeeding baby. Chelation is calcium, I've talked about that, and hepatic inducers, they reduce their half-life. They are affected by hepatic inducers, for example, rifampicin. Of course, they are categorized into short-acting, intermediate acting, and long-acting. They are drugs of choice in treatment of rickettsia, mycoplasma pneumoniae, so they can be used to treat atypical pneumonia. They have very many uses. They have been used in cholera. They're effective against chlamydia infections. That's why we use them in PID. However, they are no longer recommended for treatment of gonococcal infections due to resistance. They have been used in treatment of plague, taulemia, or what we call rabbit fever, brucellosis. And they also have antimalarial effect, especially doxycyclines. In acne, bronchitis, Lyme's disease, relapsing fever, look no further. Adverse effects, of course, nausea and vomiting is very common. Because of their broad spectrum, they inhibit the normal flora, and they accumulate in the growing bone and teeth. Therefore, they are contraindicated in children below 12 years. They are also contraindicated in pregnancy. They cause permanent tooth damage, just like you see in that photo. They have other side effects, for example, hepatic function. They can impair hepatic function, renal tubular acidosis, very many others that I've already talked about, dizziness, vertigo, nausea, and vomiting. And they are used in very many ways. So if this video was too fast, take your time, pause as you note down. Thank you so much. Like, follow, and comment.